Hmm. Hi, Dr. Harriman. Hi, Dr. Safuji. Hi, Dr. Samara. Hi, Dr. Hamilton. And hi, Dr. Hamilton. And hi, Dr. Raja. Thank you for joining me for my oral defense presentation today. And today I'm going to cover the background information, the research background of my study. And then I'm going to talk a bit about the research methodology. And then I will also talk about the major finding of my study. So my project title is Effective Countertransference Management through Experiential Learning Informed Dream Interpretation in Chinese Novices. And that pretty much means I was trying to investigate how the new Chinese therapist using dream interpretation as a tool to learn the way to manage their countertransference. And I'm using experiential learning theories as a theoretical framework to evaluate and explore the process. The next slide is the background. And when I was doing my literature review, I came across something interesting, find by some kind of finding by Gao, Chen, Fan, Hobbes, Tracy, Van Brenda, and Fellows, and other researchers over the last 5 or 6 years, and they found that the Chinese novice therapists they having problem with their countertransference. They struggle with countertransference, especially during their beginning professional journeys for several reasons. One of the reasons was because when some of those therapists recognized their need for support, but almost half of them didn't receive enough clinical supervisions to learn the way to deal with those responses. And when some of them may know a little bit about, learn a bit about the theoretical knowledge, about the knowledge about the countertransference, but they didn't know how to transfer those knowledge to some kind of actual clinical skills. And when they try to manage those responses, they rely on something not so effective methods to deal with those responses, such as some of them may try to maintain an emotional distance with their clients. Some of them may try to cry along after section, and some of them may even try to prematurely terminate their sessions with clients. And more specifically, Haynes mentioned that suggests that those new therapists may be missing some of the five major countertransfer management skills, which include self-insight, self-integrations, empathy, conceptualization, and the anxiety management skills. So, in order to help those new therapists to develop the clinical skill they need to manage their countertransference, um, other researchers suggest that we may need to take a look at two different components. Coker, Lin Fans, and Turton they suggest that first we need to take a look at the experiential learning component because those components was associated with new therapists' favorable learning outcome. And Courage in 2010, 2014, and 2015 suggests the second component we need to take a look at is the structural and systematic learning component because they found that their new therapist participants enjoy learning more advanced clinical skills through this kind of components. And I also found that the dream work actually carry these two components, having the experiential component and also having the systematic and structural learning components at the same time. And other researchers such as Gupta, Hughes, Klein, Sims, and Tian and Chance and other researchers, they already conduct a bunch of quantitative studies investigating the benefit of using Dreamweaver not only with the clients but also with therapists. And they already found that DreamWork there's a connection between the DreamWork and the counter transfer management skills. But the question we made, how that happened, how the Chinese novices, I mean, how the therapists learn to can use the DreamWork as a skills as a tool to learn the clinical skills, and that became the focus of my study. And the next slide is the theoretical framework. So in order to understand how that happened, how's the learning involved, I was using the qualitative research approach. Specifically, I'm using a single case study and trying to investigate how a particular participants develop and this kind of clinical skill, how those clinical skills evolve by using the dream work for a couple times over a period of time, which is 5-month period from a study. And I'm also using Knopf's experiential learning theory, especially the 4 stage of experiential learning cycle to evaluate the process, which include a concrete experience, reflective observations, abstract conceptualization, and the active experimentation stage of the dream work. I need to take a break. Sorry. Okay. For the concrete experience, that pretty much means the learner was trying to participate and involve himself in a very concrete piece of learning experience. And for the reflective observation stage, the learner was trying to reflect upon and try to evaluate and explore and examine what just happened. His immediate learning experience, trying to reflect upon those things. And in the next stage, the abstract conceptualization stage, the learner was trying to integrate all the information he just received from the previous stage, try to integrate those information in some kind of new theory, some kind of new hypothesis, or some kind of theoretical framework, new theoretical frameworks to capture the new learning experience. And the last stage is active experimentation stage. That pretty much means the learner was trying to put everything to the test, try to put the new knowledge, new theory, and new hypothesis to the test to see if he can use the new knowledge to make a change in his real life. So the next slide is the major research questions. For my study, my major research question is how can Chinese novices learn to manage their countertransference effectively through an experiential learning informed dream interpretation approach. And in order to answer this main research question, I'm asking five different research sub-questions. The research sub-question number 1 was I'm trying to understand what are the specific obstacles experienced by the new Chinese therapists when they try to manage a countertransference. And for the sub-question number 2 to sub-question number 5, basically I'm asking very similar questions. I'm asking how the Chinese novices learn the specific countertransfer management skills during each particular stage of dream work, which is from the concrete experience stage to the last stage, which is the active experimentation stage of dream work. I'm asking how that participants develop those clinical skills during each specific stage of dream work, from first day to the last stage of dream work. And then the next slide is the research methodology, just like what I mentioned before. It was a single case study. And in order to advertise about my study, I talked to my colleagues about my study and asked them for any recommendation, any suggestion for any kind of good candidates they can provide. And then I set up an appointment with the candidate to set up some kind of like a pre-interview section, some kind of introductory meetings to cover the informed consent issues, to cover the demographic informations, and also to do a little bit about the screening procedures, some kind of safety procedures, using outcome questionnaire 45.2 to make sure the person was emotionally stable enough to join my study. And I'm also using a selection criteria suggested by Hugh and Knopf in 2010 to make sure the persons can benefit the most from dream work. And those criteria include the participant's level of psychological mindedness and the person's attitude toward dream work, and also include the person's ability to recall dreams. And also I'm trying to assess the person's how often the persons can remember countertransference experience as well. And the participant I chose, I got was 26 years old Chinese female therapist. She was studying and working in Hong Kong. And she graduated with a bachelor degree in psychology and counseling. And she also studying a counseling psychology master program now in Hong Kong. She has been working as a full-time advanced school counselor for the last 2 years. And now she is working as a trainee psychologist in a school counseling training center. And basically what I did was I invited her over for the study for the 5 month periods of for the study of 5 month periods, and I also asked her to use the a manual called the Manual for Self-Guided Dream Interpretation developed by Hughes, Heaton, and Peterson in 1996. And this was a very user-friendly, very easy to follow step-by-step approach kind of manual. And I asked her to use this manual as a guideline to work on her own dreams as many times as she liked. And in the meantime, I also asked her to send me some kind of documents for the later data analysis in the later stage. The first kind of thing I asked her to send me was some kind of self-reflective journal entries, talking about to record and write about her daily countertransference experience and also how she deal with them. I asked her to send me every 2 or 3 weeks. And also I asked her to send me the record of her dream work, the dream journeys, dream journals, about how she use the manual to analyze her own dreams, and asked her to send me every once a month. And also I asked her to conduct and invite her back to my office to conduct a face-to-face structured interview with her by the end of each month to cover the questions such as how she learned to use a dream work at different stage, to learn the skills to manage this kind of transference, these kind of things. And by the end of the whole research period, I received a total number of seven self-reflective journal entries from her and 3 pieces of the dream journals from her. And also we met 3 times to do the face-to-face interview. And after I received everything from her, I upload all those data, those information to an online platform called online qualitative research platform called The Do's. And it's a very user-friendly platform and applications. And I upload everything under the do's, and then I try to organize data over there and look for some kind of emerging data, emerging themes and patterns over there, and also do a bit of the thematic analysis in order to answer my research sub-questions. And here what I found for the research sub-questions. For the research of question 1, which is what are the specific obstacles experienced by Chinese novices when they try to manage account transference? And what I found is that there's 2 types of major obstacles. The first type was the lack of, the lack of effective skills. And the second obstacle was the use of improvised methods. For the first one, the lack of effective skills, what I found was actually Chinese novices, they don't have the skills to deal with their countertransference. For example, according to the participants' comments and data, she mentioned that she doesn't know how to manage account transference. At the same time, while remaining genuine to her clients, she doesn't know how to do that. And also, she doesn't know how to respond to clients' similar issues, to clients' relationship problem similar to herself. And also, she mentioned she didn't know, she had a hard time to control her disappointment and discouragement in the sessions. This is so basically the participant having a hard time to manage those things. And when she's trying to manage her countertransference, she was using some kind of self-empathized method to deal with them, such as the self-talk. And 28.6% of those methods was just by self-talk, such as just tell herself to calm down, to control her difficult feelings. But more frequently, more heavily, she relied a lot on self-suppression, which accounts for 43% of the methods she used to manage those feelings. The kind of suppression she did was she tried to hold back her self-disclosure, tried to limit and cutting down her feedbacks, and tried to ignore her own emotional responses. And that doesn't work so well, because she mentioned that those kind of suppressed countertransference feelings might actually emerge again in the dreams at night, and she still have to deal with them even though when she's trying to push them away and try to suppress them. So that's why I think dream work might be a good platform and good opportunity for them, for new therapists, and try to work through and try to resolve their to eventually work through and resolve their suppressed countertransference feelings. For the sub-question number 2, which is how can Chinese novices learn a specific countertransfer management skill during the first stage of dream work, which is a concrete experience stage of dream work. And I found that during the concrete experience stage of dream work, the participant basically do two things in particular. She was trying to record in detail, write down all the dream stories. This is what she did in the first thing she did. The second thing is that she tried to pick a number of dream elements from the dream story to further work on them, to analyze them. First, for my participant, she picked three different dream story to work on, and what I found is that all those dream stories have some kind of negative emotional tones, and some of them are nightmares, some of them are some kind of scary story, and some of them have sad endings, and none of them are pleasant at all. And those are the stories she picked for the dream analysis. And from there, she select about 38 different dream elements to work on them. And I found that over 60% of those elements actually relate to something real in her life, such as the people she knew in the school and people in her family. And also some of the elements relate to the places she go to quite often in her life, like some kind of school building and some kind of outdoor environment she might visit from time to time. And sometimes those dream elements might relate to a recent negative emotional experience in her life, such as her sense of her sense of panic, sense of panic. Sorry, I try to sense of panic, sense of shock, and sense of fear, experience of fears in her daily life. And by doing those things, what I found was the participant was able to develop two specific clinical skills. The first is the anxiety management skills, and the second piece was the self-insight skills. And for the anxiety management skills, the participant was able to understand and recognize her anxiety, her nervous feeling in the dreams, and she was also to identify her passive role in the dream as a source of anxiety. And then she was able to bring those new emotional awareness back to her section room, working with clients, and understand her countertransference anxiety better and try a better way to manage them. And the second thing she developed during this stage was the self-insight skill she developed. And basically, she learned a way to follow her gut feeling when she's trying to select the right elements to work on. She learned to follow her gut feelings. And later on, she recognized all those elements mean something to her. They are actually very important and meaningful, even though she didn't recognize it in the first place. So basically, she learned to trust her own intuition, instinct, and trust her gut feeling better when, in terms of picking the right elements to explore and in terms of explore her own issues. So you get a better sense of self-insight. For the sub-question number 3, which is how can Chinese novices learn the specific clinical skills through the second stage of dream work, which is the reflective observational stage of dream work. In this stage, what I found is that basically the participants was trying to reflect upon those elements she picked from the previous stage in much more details, try to reflect on them, examine, and try to explore those elements in 3 different ways. The first way she did was that she trying to reflect upon her personal emotional responses to those dream elements. And 68.4% of her emotional responses was the negative type, such as her feelings of worry and sadness and other negative feelings about those some of the dream characters. And the second thing she did was that she tried to evaluate, explore the symbolic meanings of those dream elements. And I found that 60.6% of those symbolic meanings actually relate to some kind of negative experience during her new professional journeys, such as her sense of insecurity, her sense of danger, sense of burnout, and sense of grief during her clinical work. And also, I found that the participant also try to identify the triggering events associated with those dream elements by doing some kind of free associations. And there's a 60.5% of those events related to her clinical work in the daily life, including her countertransference incidents with clients. So basically, all those reflection was help her to link back to her clinical experience and especially the challenge in the clinical work. And by doing all those kind of explorations and evaluations, and she was able to further develop her self insight skills. And what I found was like she was able to discover and understand her unresolved personal materials might already be accidentally projected on the clients and became the source of the countertransference. She also developed the courage to do more self-explorations, and we all know that sometimes it can be quite scary when we try to get to know ourselves better. But she learned, but by using DreamWorks, she eventually become more braver and have more courage, develop the courage to do more self-explorations. And she also recognized the counter-transferring feelings and thoughts provoked by the clients. So basically, she get a better sense of self-awareness, self-understanding, understand better about counter-transference feelings. For the sub-question number 4, which is how can Chinese novices learn the specific counter-transfer management skills through the third stage of DreamWork, which is the abstract conceptualization stage of DreamWork. And in this stage, what I found was that the participant was trying to make sense of her dreams, trying to create some kind of meaning, some kind of core meaning, try to integrate the information she received from previous stage to create some kind of meaning. And there's 3 ways she's trying to interpret her dreams. First thing she did was she tried to interpret her dreams as showing important waking life emotions. And I found that all of those emotions are the negative type, such as anxiety, fears, indifference, hurt, and exhaustions in her daily life. And she also interpreted her dreams as the product of her major life events. And I found that 57.1% of those major life events was a current challenge in her clinical work. And I also found that the participant was also trying to see her dreams, trying to interpret her dreams as showing important inner personality dynamics, such as her vulnerable self, such as her non-empathic self, and also such as her unbalanced self. By making all those kind of interpretation and those kind of core meanings, I found that the participant was able to further develop 3 different pieces of clinical work, including the conceptualization, and then the empathy, and also the self-integration skills. For the conceptualization skills, what I found was by using DreamWorks, she learned to use the psychodynamic theories to apply her own dream, to analyze her own dreams. And she also able to use the same theory to recognize and understand the client's conflictual internal dynamics. And she also using the same theory. She was also able to use the same theory to understand her own role in the therapy, how she contribute to the interpersonal dynamic in section. So basically, by using the DreamWorks, she learned to use a more advanced, more difficult theoretical framework to evaluate, to understand what's transpiring in the therapy room. And for the empathy skills, what I found was that she learned to use the DreamWork to understand the client's perspective and underlying emotions. And she was also able to use a more objective standpoint to evaluate her own feelings. And by doing those things, eventually she developed more empathy, not just for herself, but also for her clients as well. And for the self-integration, which pretty much means the person was able to develop a much stable and healthy and intact sense of self-identity, have a better ego strength, and can do a better job in terms of doing a self-differentiation and setting boundaries with clients. And what I found was that the participants was able to differentiate better between her own needs and clients' needs. And she also able to acknowledge and accept her wishes of punishing the resisting clients. She was able to tell herself that yes, to accept that she's just an human being. She was just an imperfect human being, having her dark side as well. She able to accept that part. And also she able to, I found that she learned a way to recognize her need for approval, being in conflict with the client's need for acceptance. So she get to know herself better. So basically what I found is that she was becoming more genuine, become more self-integrated, become more willing to accept who she really was. For the research question number 5, which is how can Chinese novices learn specific clinical skills during the last stage of dream work, the active experimentation stage of dream work. And I found that during this stage, the participant was trying to turn her new knowledge, try to turn her new understanding into some kind of action plan, some kind of future planning, or making some kind of changes. Specific, she was making 3 different kind of changes. First, she was trying to make some changes in her dream story, and for example, she tried to turn those negative dream story to more positive emotional tones, and try to create some kind of happy endings to them, and try to bring some closure to those dream stories. And she also decided to make some changes in her life, in her waking life, such as she decided to take a break from her busy working schedule, and she also decided to take care and protect her vulnerable self more. And she also decided to overcome and face her fear. And the third thing she did was like she decided to continue to work on her future dreams, and she thought and she believed it can help her to understand herself better and continue her self exploration work. By doing those kind of changes and making those kind of plans, I found that the participants was able to develop the anxiety management skills more, even better. And for the anxiety management skills, I found by using dream work in that stage, in the last stage, she learned to use more mental rehearsals to prepare for the future sections. And she also learned to put her client's needs first to try to reduce the client's resistance, and that helped her to eventually contain and reduce her level of anxiety as well. And by doing those things, more importantly, I found that she learned to accept her own anxiety by telling herself something like, "It is okay to feel anxious sometimes. I'm just a beginner, so it's okay to feel that." And that helped her. Actually, that helped her to create some kind of give her a sense of self confidence, and help her to give her some kind of control feeling, some kind of control. And the next slide is the implications for practice. For the clinical supervisor and counseling educator, I would like to suggest that when they're trying to supervise, trying to consult, trying to train those new Chinese therapists, I think they can take a look. I mean, they need to pay attention to the possibility that some of those new therapists may don't know how to manage their countertransference at all, and some of them may rely too much on some kind of suppressions to deal with them, and those things doesn't work. And when when the supervisor and educator, when they're trying to introduce some kind of new training activity to them, they can also take a look at 2 different components: the experiential learning component and the systematic structural learning components, such as stream work, because we found that new therapists learn best from those two kind of learning components. And also, when they try to determine if this is the right time to introduce dream work to their trainee and supervisees, they can consider the selection criteria suggested by Hughes and Knobs in 2010, which are the same criteria used in my study, just like what I mentioned before. And for the new therapist, I would suggest that if the new therapist was trying to develop their self-insights, such as develop the gut feeling to pick the right elements to work on, such as to become more braver, having more courage to do the self-exploration work, I think they can focus more on the first and the second stage of the dream work, which is the concrete experience and the reflective observational stage of dream work. If the participant was trying to develop her anxiety management skills better, try to develop that part, that piece, and I think she can or he can focus more on the first and the last stage of dream work, which is the active experimentation. the concrete experience stage again, and then the active experimentation stage of framework. If the new therapist would like to either develop her to foster her anxiety, the empathy skill, the conceptualization skill, or the self-integration skill, then the person can focus more on the third part of dream work, which is the abstract conceptualization stage of dream work. And the next slide is the recommendation for research. For the future researcher, I would suggest them to replicate my study in a much larger Chinese novice population, because we know that the major drawback of single clinical case study is the limited generalizability. So I think they can replicate my study in a much larger scale, much larger populations. And then I also think they can use different kind of sampling strategy rather than the convenience strategy in my study. And they may even use some kind of objective measurement to capture the participant experience, rather just using their journals and using interviews. Second thing I would suggest is that they can try to evaluate the effect of dream work within the context of clinical supervisions. And I would suggest they may try to compare dream work plus supervision versus clinical supervision alone to see if dream work can have some kind of positive impact, some kind of influence, some kind of benefit on the overall clinical supervision quality. And more specifically, I think they can take a look at those variables suggested by Bucky in 2010, such as supervisory self-advocacy and quality of working alliance with supervisees and teaching of difficult, the effectiveness of teaching difficult concepts. And I would like to suggest them and the future researcher to try to compare the dream work with other type of experiential learning interventions, such as the big topic, the hot topic, mindfulness interventions. Maybe try to compare with the creative arts making type of intervention as well. And maybe they can just compare the dream work with like imagine conversation with clients, such as role play, those kind of interventions. And to see if those interventions can help the new therapist to develop clinical skill in a different way or similarly. Because I think it's always a good idea to add new steps, to add more interventions, newer tools to therapists' toolbox. So basically, this is the end of my presentation, and I really appreciate your time to join me today. And I hope you enjoy the content of my presentations. Thank you.